until the end of Dr. Murphy's discussion. If you have any questions throughout this presentation, please feel free to put those into the chat. And our goal is to answer a lot of questions tonight at the end of this, and we'll read those. If you have a question that maybe you have some difficulty wording or just putting in word form, make a comment of that. We'll unmute you at the end of this and allow you to ask that question so that we make sure we get as good of an answer for you as we can. So just a couple of things on EAPK, a pretty common acronym for those of us that are familiar with it, but the Eastern Alliance for Production Katahdins was formed, Brad, you might have to correct me, 4 or 5 years ago now. So still relatively new in terms of a sheep association. And yes, that Katahdin name is in the title, but we are equal opportunity when it comes to the sheep industry. So there's a lot of really good content, not only in our virtual programming like this webinar, and we do a open forum the third Monday of every month that, again, we'd love to have as many of you that are in here show up, and it's just an opportunity for us that are all over the country to come together and have discussion on things we're going through and some timely topics. And then the only other thing I wanted to mention is there is a annual symposium that'll be held July 12th through the 13th in Cookeville, Tennessee. And if you've been in the past, you know that it is a rigorous educational event. And again, regardless of what type of sheep you're raising, I think it has value for a number of producers anywhere in the country. So with that, Brad, if you've got anything you'd like to add, feel free. And if not, we will let Dr. Murphy take it away.
Thanks, Cam, for that introduction. I think you covered just about everything. So we will turn this over to Tom. Look forward to what he's got to share with everybody.
Thanks, guys. I think you'll need to enable my screen sharing.
Does that work, Tom?
Looks like it. Okay. We all see my slides then?
Looks great.
All right, good deal. So thanks, Cameron. Thanks, Brad. Like they said, my name's Tom Murphy. I'm a sheep geneticist at the Meat Animal Research Center in Clay Center, Nebraska. And I guess somewhere along the way, I've been mistakenly identified as some sort of expert on mastitis in sheep. In reality, I'm just a sheep geneticist that's uncommonly good at milking sheep. So it's been kind of a central theme of my research projects, but I'm not an immunologist or a veterinarian. Just coming at this from a pure genetics and economic impact perspective. So what is mastitis? In its most basic definition, it's just an inflammation of the mammary gland, and that's typically in response to a bacterial infection. And what you all are familiar with as sheep producers is clinical mastitis, where the ewes got immense udder swelling. That tissue can become discolored, might be warm to the touch. If we milk that ewe out, she's producing an abnormal milk. And then that ewe can become depressed, go off feed. And if we don't intervene, she does stand a pretty good chance of dying. So that's clinical mastitis, but we also have subclinical mastitis, where a ewe is still harboring a pathogen in her mammary tissue, and she's mounting an immune response to it, but that immune response isn't large enough that we're able to detect visually. Visually, that ewe looks completely healthy to us. Her milk looks completely healthy to us. And the only way to detect subclinical mastitis is to collect a milk sample and screen it for bacteria that might cause subclinical mastitis. From a practical perspective, this is pretty expensive to do for sheep producers. Most of your state diagnostic labs are going to have testing kits that are more geared towards detecting subclinical mastitis within dairy cattle. So those, there are some overlap between those pathogens, but there are some unique ones in sheep that might not be picked up. So we can infer subclinical mastitis also by quantifying the amount of white blood cells or somatic cells present in a milk sample. We refer to this as somatic cell count. So as those pathogens invade the udder tissue, that use mounting an immune response to it. So higher somatic cell counts would indicate subclinical infection if she's not showing us any clinical signs of the disease. And typically, most diagnostic labs can do this for $2 or $3 a sample, but it does require shipping in milk to a commercial lab. There's other forms of somatic cell counting that we can do that are a little bit cheaper, and you can actually do them on your farm or on your ranch. One of these is the California mastitis test. This is pretty simple to do and get trained on. You can buy this on Amazon. It's about 3 cents a sample. And it correlates very well with electronic somatic cell counting methods. Basically, you just mix milk with the solution that's provided to you in the kit, and then the solution binds with white blood cells in that milk sample. And the more and more white blood cells are in that milk sample, the solution becomes more and more viscous. So you score that solution for how gel-like or viscous it is, with higher scores indicating subclinical mastitis. And where there's very little thickening or gel formation, we'd say that U is likely to be free from subclinical mastitis. And as with any subjective scoring method, there's some gray area where a score of 1, we're really not quite sure where that U might lie in terms of subclinical mastitis. So looking at a global perspective of the prevalence of the different forms of mastitis, across flocks sampled in New Zealand, they estimated a prevalence of clinical mastitis of about 2% of ewes. Across flocks in the UK, about 3%. And in Canada, about a 1% incidence of clinical mastitis. And that's across flocks. We know that within flocks, that prevalence of clinical mastitis can be quite variable. In this study done in the UK, within flock prevalence ranging anywhere from 0 to as high as 37% incidence of clinical mastitis. But generally across flocks, across the sheep industry, the incidence of clinical mastitis is fairly low. Subclinical mastitis typically occurs at a much greater rate. In Australia, about 14% of ewes sampled were diagnosed with subclinical mastitis, 12% in the UK. In this same study that found a 1% incidence of clinical mastitis, they reported a 28% incidence of subclinical mastitis. And then here in the States, the research flocks at Virginia Tech University, over 30% of ewes sampled had subclinical mastitis, and at Iowa State University, about 15 to 25% of ewes sampled diagnosed with subclinical mastitis. So much more common form of the disease. So if we had a snapshot of any individual flock, we'd have hopefully most of our ewes healthy. We'd have anywhere from 2 to maybe 5% of our ewes having clinical mastitis. These ewes are pretty important, but it's fairly easy for us to diagnose them based on their udder or abnormal milk secretions. But then we have this whole group of subclinically infected ewes that might range from 15 to 40% of our flock at any one given time. And they could be transitioning into a healthy state or back from it, or go full clinical. It just depends on where we catch them. But they appear completely healthy to us, and their milk looks completely normal. It's only until we're able to do a test like the California mastitis test where we can diagnose subclinical mastitis. So the economic impacts of clinical mastitis are pretty clear to us. Those ewes that get infected clinically have been found to be about 4 to 5 times more likely to die than a healthy ewe. But you all know that we have costs associated with treating that ewe in the form of antibiotics. We're typically going to have to rear one or more of her lambs on milk replacer if we don't graft them onto another ewe. And then we're typically going to cull that ewe with clinical mastitis. And so we've got costs associated with having to replace her with a ewe lamb that we could have sold as a feeder lamb or sold as a breeding animal to somebody else. For subclinical mastitis, the economic impacts are a little less clear in meat and wool sheep. We know from the dairy cattle industry that as somatic cell count increases, we decrease milk production. So we might expect this general relationship to remain true for sheep. In one study conducted in the United Kingdom, they actually inoculated ewes, injected into their teat canal a pathogen that causes subclinical mastitis. They found that those ewes remained clinically healthy. They didn't get clinical mastitis, but when they collected data on them, they found that those inoculated ewes produced 37% less milk than the control ewes. And lambs reared by these infected ewes weighed 9% less at weaning than lambs reared by the control ewes, which doesn't seem like a lot reduction in weaning weight, considering their dams were producing 40% less milk. But what they also were able to quantify is that lambs that were reared by those infected ewes consumed 25% more creep feed than lambs reared by control ewes. In this production system, those lambs were able to, in part, make up for their dam's loss of milk production by consuming more creep feed. But of course, that has a cost associated with it. And if you aren't providing creep feed to your lambs, that would likely show up as large reductions in lamb weaning weight. So our first investigation into subclinical mastitis in sheep, I started when I was at Montana State University. This project included ewes both at Montana State that were targy and Rambouillet, and ewes at the U.S. Sheep Experiment Station that were mostly terminal type breeding. We collected milk at 2 time points on these ewes: in early lactation about 5 days after lambing, and then at mid lactation about 35 days after lambing. All ewes that we sampled were clinically free of mastitis. They didn't show any clinical symptoms. Their udders were healthy. The ewes were in good shape. And then we quantified somatic cell count on all of these milk samples we collected, and speciated bacteria on a subsample of them, which I'm not showing tonight, but if you got questions on that, I'd be happy to share. What I am focusing in on is the production impact of somatic cell count on sheep. We found that ewes that were again, clinically healthy, but had high somatic cell counts, which we set at greater than 500,000 cells per milliliter. Those ewes weaned, depending on what flock and what breed we were looking at, anywhere from 11 to 35 pounds less total weight of lamb than ewes with low somatic cell count. So that in and of itself is a large economic impact. It's larger when we consider that those high somatic cell count ewes represented 25% of the flock that we sampled. So it had a large economic impact, and it was very common. So we know that milking ewes is labor intensive, and if we're looking to impart change at the industry level to improve udder health, most sheep producers aren't going to go out and milk all their ewes. So we're constantly trying to identify ways that we can maybe diagnose mastitis and subclinical mastitis a little better, or select for it as a secondary selection criteria, which I'll point on later. But one of our first investigations on a diagnostic tool was using infrared imagery, taking pictures of the udders of ewes to calculate surface temperature of those udders. As I said, any ewe that's got an udder infection is likely having increased udder temperature due to inflammation. So we wanted to see if we can pick up that subclinical mastitis based on udder temperature. But when we look at this graph, udder surface temperature and somatic cell count were virtually unrelated to one another. So it didn't appear to be a very useful tool for us to really take any further than that. Another study I did with Brett Taylor at the Sheep Experiment Station looked at the relationships between ewe milk production and udder health and how that impacts her reproductive performance. So at the Sheep Station, since 1985, they've been collecting subjective milk production scores on all the ewes that come through the lambing shed. So this is just kind of gauging the size of the ewe's udder. They might take a few streams of milk, but just a subjective score that's saying this ewe appeared to have low, average, or high milk production shortly after lambing. So they've been doing that for 35 years. They've also been taking subjective udder scores at weaning. When those ewes wean their lambs, they bag those ewes, and they've got a pretty large scale that they use, but I concatenated it into smaller classes, basically describing ewes at weaning who had normal, healthy looking udders. They just weren't producing milk at weaning anymore. This is typically 120 days that they're weaning lambs. Ewes that had normal appearing udders, but were still actively producing milk at weaning. And then ewes that had pendulous udders, or what we might call swing bags. Ewes that had lopsided udders, one udder half being deeper or larger than the other udder half. And then ewes that had other udder damage. Maybe they had intramammary masses or damaged teats. They were all kind of combined into one category. And so we had records from Polypay, Rambouillet, and Targhee ewes at the Sheep Station, over 8,000 Polypay records, 7,000 Rambouillet, and 8,500 Targhee ewes. So it's a pretty big data set going back over the past 35 years. And we calculated total weight of lamb weaned per ewe lambing as really our indicator of ewe productivity. This table just shows in kilograms within each of those three breeds the total weight of lamb weaned per ewe based on her milk score taken near lambing and her udder score taken near weaning. So within each of these breeds, not really surprisingly to us, ewes that were scored as having high milk production near lambing went on to wean the heaviest litters of lambs. These are in kilograms. So ewes with high milk production weaned on average about 10 kilograms or over 22 pounds more lamb than ewes that were scored as having low milk production shortly after lambing. Again, not really surprising to us. But what was fairly surprising to us was that when we look at total weight of lamb weaned based on udder scores taken at weaning, ewes that came in with swing bags or asymmetric lopsided udders ended up having weaned the heaviest total weight of lamb. So it wasn't the ewes with the normal udders that were still kind of making milk. It wasn't the ewes that had normal udders that might have dried off a week before weaning. It was these ewes with swing bags and asymmetric udder. So obviously, milk production is important, but if we're pushing milk production so far that it's creating ewes that are having significantly damaged udders, that we're going to probably consider culling because that udder isn't going to rebound very well for the next lactation. It's not a very good thing. So we've got to be constantly thinking about optimizing certain traits. And this next slide shows that what the relationship is between that milk score taken near lambing and the udder score taken at weaning. Not really important to know all the intricacies of this table, but basically what we're showing here is that ewes with high milk score near lambing were 2.2 times more likely to come in with pendulous or asymmetric udders at weaning than ewes with a low milk score. So again, pointing to the fact that milk production, like many traits, should be optimized for our production environment and not maximized. And then another previous study I'll just share with you from US Mark. Maybe some of you are familiar with an experiment that Craig Lymaster started before he retired that compared Katahdin, Polypay, and Composite 4 or Easy Care ewes in a low input pasture lambing system for their first 4 years of lambing. That experiment's done. We added on to it once these ewes had lambed on pasture for 4 years. We lambed them in the barn, and then we collected a lot more traits that you can't collect in a pasture lambing system, namely maternal behavior, lamb behavior traits that we recorded with video, but also we scored the ewes' udders and collected milk from them to see, how udder conformation and health in the 5th parity might be related to their previous 4 parity performance. So basically what this table shows is that within each of those 3 breeds, Katahdin, Polypay, and Composite 4, the message was pretty clear that ewes with high California mastitis test score, so a 2 or 3 being a high within each of these 3 breeds, weaned 17 to 26 pounds less lamb than ewes of the same age and the same breed, but with low California mastitis test score, being clear from subclinical mastitis. So again, a very large economic impact, and again, very common, as about 25% of these ewes also had subclinical mastitis. So the first study that we did was in fine wool ewes in a range production setting. These are hair ewes, maternal wool ewes in a pasture lambing situation in the Midwest. But the same message came out that about 25% of ewes had subclinical mastitis. All right, so we began shifting perspective on how we're looking at improving udder health. Most of these studies that I've shown you tonight have been observational, where we just milk ewes and we look at their performance within that same year. But we know that if we want to alter components of ewe longevity through selection, we're going to need more prospective studies where the same ewes are repeatedly scored throughout their productive lives. And furthermore, incorporating genomic information as well as records collected on industry flocks, not just research flocks, will improve how accurately we can select for a lot of traits, including components of ewe longevity. And so this is really the major driver behind this Sheep GEMS effort, led by Dr. Ron Lewis and Luis Brito, and myself, and Joan Burke, and other scientists at the Sheep Station and US Mark are involved in this. I'm kind of taking the lead on the components of udder health as they relate to productive longevity. We've decided to not only be recording in our research flocks, continuing to collect milk samples, but identifying indicator traits that might be related to intramammary health, but more easily measured. And so we've arrived at 2 udder traits that we're asking participating flocks, many of you involved in this, to collect. Those 2 udder traits are udder depth, so how deep the base of that ewe's udder is relative to her abdomen, with higher scores indicating an udder closer to her abdomen, low scores indicating a deeper udder, where about a score of 5 is right at the hock. We're also scoring teat placement, just the position of the teats relative to the base of the udder, with 1 being basically the teats are pointing straight down, and 9, the teats are further up on the udder and pointing straight out. And previous work, mostly done in dairy sheep, has found that these udder morphometric traits are heritable. So this table shows heritability of udder depth and teat placement, 25 to 40%. They're not only heritable, but they're also genetically related to other important traits, and dairy sheep, milk yield being important, but we're also concerned about milk production in meat and wool sheep, as well as somatic cell count. So this shows milk yield and somatic cell count are positively genetically correlated. As we increase milk yield, we tend to also increase somatic cell count, or the likelihood that a ewe becomes infected with mastitis. That's been shown in many different species. But what we also find are genetic correlations between milk yield and udder depth, a negative genetic correlation, meaning that as we decrease udder depth, in this case, it becomes closer and closer to the ewe's feet, we increase milk yield. So that makes sense, right? Larger udders produce more milk. We also find that same direction of relationship between udder depth and somatic cell count. Deeper udders tend to also be more prone to mastitis. So there's double-edged sword there. And for teat placement, not necessarily related to milk yield very strongly, but it does have a positive genetic relationship with somatic cell count, whereas we get teats with higher teat placement score going up to 9 increases somatic cell count, at least in dairy sheep. So the past few years, we've been collecting data to see how feasible these measures, and we're taking other measures as well, see how feasible they are to collect routinely, as well as eventually, hopefully, apply within our genetic evaluation program, or NSIP. So we started collecting these measures on our Katahdin ewes at US Mark before Sheep Gem started. So we've collected from 2020 to 24 or 2023. We haven't started lambing yet this year. Over the course of those 4 years, we've collected about 1,100 udder scores taken near lambing. We're also taking udder scores near weaning. Similar number have been collected, and they've been collected repeatedly on some of the same ewes over their productive lives. 637 unique ewes have been recorded. We also go a step further and collect milk from our 1-year-old and 4-year-old ewes that we use to score for California mastitis test. And for most of this presentation, I'll be using total weight of lamb weaned here, adjusted to 75 days of age, as kind of our indicator of ewe product. So this is what our udder depth looks like, taken near lambing, about 5 days after lambing, or at lamb weaning. And those udder depth scores within each of our ewe ages, going from 1 to up to 6 years of age. You can see these are just histograms or box plots to show the variation in udder depth scores within each of those ages. Generally speaking, as we increase ewe age, we increase average udder depth, which I think makes sense to most of us. Older ewes produce more milk and have deeper udders. And in general, udder depth taken near lambing is ewes have deeper udders than they do at weaning, which again makes sense as they're decreasing milk production. Their udders are becoming less and less deep. So if we kind of look at the most common score within each of those ewe ages, 7 appears to be most common in ewes up to 3 years of age, and then 6, udder depth score most common at older ages. So how does udder depth relate to ewe productivity, or total weight of lamb weaned? This is within ewe age categories, looking at her udder depth at lambing on her total weight of lamb weaned. Udder depth at lambing for first parity or 1-year-old ewes doesn't statistically significantly differ among those udder depths for 1-year-old ewes. But for all other ages, we see udder depth taken near lambing has differential impacts on how much weight that ewe goes on to wean in terms of total weight of lamb weaned. In general, we see that deeper udders from 7 down to 5, deeper udders at lambing are associated with more total weight of lamb weaned for these older ages. And udders, obviously, smaller udders, 8 or 9, score of 8 or 9, are associated with lighter weight litter weaning weights. Okay, so that's udder depth taken at lambing. What about at weaning? Where we saw ewes with scores of 5 at lambing went on to have pretty heavy total litter weights. Ewes that still have an udder depth of 5 at weaning have lower weights than ewes that have more moderate 6 and 7 udder depth scores. And I think this makes sense as lambs are growing, they're becoming larger. And if their dam has a deeper and deeper udder, they're towards the end of lactation not being able to nurse that udder as well. Whereas these ewes with more moderate udder depths at weaning, those lambs are still able to nurse those udders, and it's reflective in their total weight of lamb weaned. We can kind of do the same thing for teat placement. Teat placement really wasn't impacted by ewe age. If we kind of think of 5 as our intermediate teat placement score, it's the most common score across all of these age groups, but there's certainly variation within each of those age groups. And teat placement really didn't change with whether we collected it shortly after lambing or at weaning. Individual ewes can change what their teat placement score is at lambing or at weaning, but on average, the teat placement scores were pretty consistent across those 2 time points. And looking at the relationship between teat placement score and total weight of lamb weaned, teat placement at lambing, there really wasn't any differences so far, at least in our flock, between teat placement scores in terms of total weight of lamb weaned. It seems that teat placement at lambing, the lambs are small enough that except for extreme cases where the teats are very high up on the udder, really they're able to find and nurse those teats just as well as any other teat score at lambing. But when we look at teat placement at weaning corresponding to her total weight of lamb weaned, again, ewes can change their teat placement score from lambing to weaning based on how their udder conformation overall is changing. But when we look at teat placement score at weaning, we do see differences among the scores with regard to total weight of lamb weaned, where again, more middle of the road scores like 4, 5, 6, and 7 are associated with higher total weight of lamb weaned. And again, I think this goes back to as those lambs are growing, they're less able to nurse a ewe with teats that are a score of 3 or less, so pointing closer straight down to the ground, or teats that are very high up on the udder. It's these more moderate teat placement scores that seem to be associated with better total weight of lamb weaned. We also, as I mentioned, have been collecting milk on our 1- and 4-year-old ewes to look at a California mastitis test. The 1-year-old ewes just kind of provide a contrast of a ewe that's never been infected with subclinical mastitis because they've never had a lactation before. And as expected, most of our 1-year-old ewes have pretty clear milk, and not clear, but they're free from subclinical mastitis. Only about 4% of the ewes that we've sampled as 1-year-olds have had really high California mastitis test scores. And there's some numeric differences between total weight of lamb weaned and where her mastitis test score was for 1-year-old ewes, but it's not statistically significant at this time. In general, 1-year-old ewes, the 4% that we had that had high California mastitis test score weaned lower weights of lamb, but there's just not many of them to really report that as statistically significant. Whereas within our 4-year-old ewes, again, about 25% of them have are clinically healthy but have high California mastitis test scores. And within the 4-year-old ewes, we see this steady decrease in total weight of lamb weaned as we increase California mastitis test score. So just playing around with some of this early data, seeing how do these ewes differ and other production parameters. You might think, well, ewes that have triplets will probably be more prone to mastitis than a ewe with a single. Comparing total or average number of lambs born among these California mastitis test groups within 4-year-old ewes, they basically had the same lambing rate, all about a 2 to 2.1 lambs born per ewe lambing. So it doesn't seem like the high California mastitis test scores ewes are those that have really high lambing rates. In terms of udder depth, right now, udder depth taken at lambing wasn't any different between these California mastitis test score ewes, which was kind of surprising to us. Teat placement also wasn't different between these subclinical classes. But what I did find, and I've just recently analyzed this data, those ewes more likely to have high California mastitis test scores were fatter. Body condition score about 0.3 units higher than ewes that did not have subclinical mastitis. So I haven't really looked too much at the literature, but that might make some sense to us. We don't want to overcondition our ewes for many reasons around lambing, and perhaps they're more prone to develop subclinical mastitis. Teat length also appeared to be larger in these ewes with higher California mastitis. So one of the reasons why I think we're seeing this difference in body condition score of ewes across these California mastitis test score classes, where ewes with higher California mastitis test scores seem to be fatter, might be their performance not in the lactation that we are sampling them in, but perhaps in the previous lactation. So I've just been playing around with this data today to look at that. And just kind of briefly here, this is the ewes, again, her CMT score at 4 years of age and her performance for different traits at 3 years of age. Wondering if previous lactation performance is really the driver of subclinical mastitis in that subsequent lactation. We see that number of lambs born at 3 years of age really wasn't different among these ewe classes. But what was different is, and I think this makes sense to why we're picking up the body condition score differences, is ewes that lost more of their lambs, so they had triplets at birth and they lost 1 or 2 of them, or they lost one of their singles, or they lost one of their twins, or they lost all of their lambs and didn't wean any lambs. We see that those ewes that came in with subclinical mastitis at 4 years of age were more likely to have lost more of their lambs at 3 years of age than ewes that did not have subclinical mastitis. So this is what kind of makes these sorts of projects challenging, right? We're trying to shoot for an optimal udder depth that's intermediate score. It's not high, it's not low. We're trying to shoot for an optimal teat placement. That's an intermediate score. We're trying to shoot for optimal milk production. That's easier said than done. But I think if we want to imagine what the ideal udder is, it's probably one with, as our data shows in terms of total weight of lamb weaned, a ewe that consistently maintains a depth of a score of 6 or 7, and a ewe that consistently maintains a teat placement score of 4 to 7, or more intermediate, with 5 being the midpoint there. The correlation between a ewe's udder depth taken at lambing and at weaning is fairly strong, about 50%. Likewise, the correlation between teat placement taken at lambing and weaning, fairly strong at 45%. But again, there are some ewes that have deeper udders at weaning than they had at lambing, and vice versa. There's ewes that change how their teat placement presents us from lambing to weaning. And we also see that really these two traits, udder depth and teat placement, aren't really correlated to one another, which might be a good thing. We can select for one and not worry about any unfortunate changes in the other. And this is just a graphic showing the frequency of ewes that by their udder depth taken at lambing and their udder depth taken at weaning. Again, we want to shoot for these ewes that maintain that udder depth of 6 to 7. We want to avoid the ewes that have really deep udders, either at lambing or weaning, and avoid the ewes that have really tight udders, either at lambing or weaning, because they have much lower milk production, and kind of avoid the ewes that make large swings in how their udder depth looks from lambing to weaning. So some take-home messages, wrapping up here. In many experiments we've done, we've found that there's many different pathogens that can impact clinical and subclinical mastitis in our meat and wool breeds. There's no single one pathogen. This is typically why vaccinations against mastitis have failed. In dairy sheep, they're somewhat effective, but in other meat and wool sheep, because there's so many different pathogens, there's not one single vaccine that can work to take out all of them. Across many experiments, we've evaluated 9 different types of breeds of sheep, 5 different production environments ranging from very intensive to very extensive. Basically, the same results have been found with regard to subclinical mastitis. About 25% of our ewes are affected. And those affected ewes rear anywhere from 13 to 35 pounds lighter litters than healthy ewes, depending on the breed type and the production system. But in your flock, say of 100 ewes, reducing high somatic cell counts, improving udder health, could generate anywhere from $600 to $1,600 more dollars in total lamb revenue per year. I think that's all I've got. So just special thanks to a lot of different people that have been involved in these studies, and I'd be happy to answer any questions.
Awesome. We definitely thank you, Dr. Murphey. As a reminder, before I forget, the webinar is recorded, and so if you signed up, it'll be sent to your email. And if you've got any questions, throw those in the chat, or raise your hand, and Brad will pull you off of mute and you can ask that verbally. But we do have one question in the chat so far. And that is, ewes that had pendulous or asymmetrical udders that weaned heavier lambs, were they more likely rearing singles in those situations?
I would say no. They probably weren't any more likely because they had heavier total weights of lamb weaned, which is just summed within ewe. So obviously weaning twins is the best way to get heavier total weight of lamb weaned than weaning one larger single. I'd have to specifically check that, but my memory is that there wasn't that wasn't the reason for them having heavier total weight of lamb weaned or more pendulous udders.
Okay, perfect. And then without getting yourself into veterinary jail here, can you talk about mastitis treatments at all?
Sure. Yeah, so there's been a number of studies that have looked at prophylaxis or just basically mass treating ewes for mastitis prior to or after weaning or before lambing. They've shown pretty good results, but we know now we have restricted use of injectable antibiotics. So that's probably not a good treatment. I'd say really speak to your veterinarian, or I'd be happy to put you into contact with our veterinarian here at US Mark. But our basic treatments are milking the ewe out and giving her biomycin, just kind of your typical LA 200 type drug. And they might give them some dexamethasone or something like that, but I'd be happy to point you in the direction of effective treatments. But they're pretty broad spread antibiotics that we use.
Got some questions rolling in here now. So do ewes with subclinical mastitis 1 year tend to progress into worse infections in subsequent years?
That's a good question. Hopefully our data is going to show that. In general, in dairy sheep, somatic cell count is quite repeatable across lactations, meaning ewes that have high or low somatic cell count are more likely to have high or low somatic cell count in subsequent lactations. So my guess is that a lot of the ewes that we see with clinical mastitis in one lactation may have been one with subclinical mastitis in the previous lactation, and that gave it enough udder damage to present itself in the clinical form in the following lactation. So yeah, I think the dairy literature would say that yes, it's pretty repeatable, and ewes are more likely, once they've had an infection, more likely to continue getting the infection as parities progress through that ewe's age.
Okay. And so then on that note of making the choice of whether to get rid of those individuals, can calling for clinical mastitis lower the rate of mastitis in the flock, and as well as can calling for subclinical traits lower the rate?
Yeah, so mastitis, the heritability of mastitis, you can call it susceptibility, is about 5%. So it's like most health traits, it's a very low heritability. And subclinical mastitis is a little bit higher than that. And so ultimately what heritability tells us is how well the individual's phenotype or their performance for whatever trait indicates their genetic level for the trait. So with low heritability traits, whether that's number of lambs born or mastitis, the ewe's own performance for the trait, whether she got mastitis or didn't, is not really indicative of her genetic merit for the trait. There's a lot of environmental variation that goes into whether you can get mastitis. And even if we were to identify the most genetically resistant ewes to mastitis, we can probably give them mastitis if we present them with pretty poor conditions. So culling is probably a good thing to do because that ewe that has clinical mastitis has undergone a lot of tissue damage. And in subsequent lactations, she's going to produce less milk. And as I said before, she's probably more likely to get mastitis in subsequent lactations. So you should remove her from your flock for husbandry reasons, but it's not likely that that removal is going to really push the genetic propensity of your flock to have or not to have mastitis. And also along that comment, keeping their daughters, that's kind of the silver lining, right, of a low heritability trait, is that just because that you had mastitis is not really going to be a strong predictor of her daughters having mastitis. So I would cull the ewe that has mastitis for husbandry reasons. I wouldn't think twice about, I would not cull or get rid of her daughters because she had mastitis. I'd keep those daughters in the flock and not be concerned about them being more predisposed to this.
Perfect. Perfect. Are there any studies correlating pneumonia diagnosed and treated in lambs with mothers' diagnosis with clinical or subclinical mastitis? Are there any correlations between pneumonia and the presence of mastitis in that flock?
Yeah, so that's a really good question, because one of the big, and I assume this is why they asked, and one of the major pathogens that causes clinical mastitis, Mannheimia hemolytica, is also our major pathogen for respiratory disease in lambs. So they have done a study, and it's been a few years since I looked at it, but basically seeing how that pathogen transfers from the lamb's respiratory tract to their dam once they nurse them, and vice versa. And I want to say that it was definitely a mode of transmission across sheep. I can't say exactly how much, but yes. And I think there is another comment on there of lambs transmitting mastitis to other ewes that they're robbing milk from. And so, yeah, that I would believe that would also be something that's possible based on the Mannheimia hemolytica being isolated in a lamb's respiratory tract and being common to their dam's mammary microbiome. If they're going around robbing milk because their dam isn't producing enough milk, they can definitely be a vector for that transmission as well. Really hard to quantify, obviously, but not outside the realm of possibility.
Perfect. Perfect. Good answers there. Will the udder of a ewe with subclinical mastitis feel different than if you were to feel a healthy udder?
No, they don't. There are some ewes that have, intramammary masses, small lumps within their udder or large lumps that have subclinical mastitis. It's probably an infection from a previous year that they recovered from and walled off that bacteria. So those ewes you could pick up, but there's many other ewes that have perfectly normal udders. They don't have any lumps in them. The udders aren't warm to the touch, that end up having subclinical mastitis. So really no way we can reliably diagnose it from just feeling the ewe's udders.
Then here's a fun one. Can bedding types impact the onset of mastitis? And I'll add in there maybe the transfer of that bacteria when we're dealing with mastitis.
Yeah, I'm not sure about bedding types. I would say, like, if we're talking differences between wood chips or straw or corn cobs or something like that, I think it's mostly how clean the bedding is, obviously, is a major reason why we see mastitis, but we also see mastitis in pasture lambing and range lambing flocks, generally where they're lambing in the same kind of bedded down area, and manure builds up. That's kind of major reason why mastitis occurs. So I haven't looked at real bedding differences. I'm guessing there's many dairy cattle studies that have looked at that. I'm not very familiar. A study done by a graduate student, former graduate student at Wyoming, looked at applying ag lime between jugs and how that changes kind of the microbiome of the jug as more and more ewes come through, and they showed some differences in reduction. So again, not quite sure on types of bedding, but just keeping the bedding dry, putting down lime, those have been shown to help reduce mastitis and have benefits for other health traits.
Okay. And then another environmental question here. Is lambing season, winter versus late spring, for example, an important variable for those mastitis occurrences?
It might be indirectly. I don't think, if you take the same ewe and you lamb her in the fall with twins and you lamb her in the spring with twins, that the season itself is going to be really what's driving differences in mastitis susceptibility. But if you're lambing in the middle of winter in a confined barn, then obviously that might have a higher incidence of mastitis than pasture lambing in the spring or fall does. But yeah, I'm not sure if there's any direct effect of the season apart from just kind of those management differences.
Okay. And does it make sense to do a CMT on ewes at weaning and calling those with a high somatic cell count at weaning?
I would maybe use it as a way to treat that ewe or get her some extra nutrients so she can come back to being healthy. Because remember, ewes can go from subclinical infection back to being healthy. So I wouldn't cull ewes based on whether or not they have subclinical mastitis. Yes, we saw it has a large economic impact, but we can't be culling 25% of our flock, obviously. But you do bring up a good point that what we often overlook in terms of mastitis is the post-weaning phase on ewes. Most of the time we're thinking mastitis, oh, it's occurring after the ewe lambs, but a real important time point is what we're doing with those ewes after weaning. The old, management practice of throw that ewe on, the dormant pasture or in a dry lot and feed her straw because you want to dry her up. That ewes need nutrients after weaning to repair their udders, and restricting those nutrients is probably not a good thing. So, but it brings up the good point of that post-weaning phase is really important to not just wean lambs and kick ewes out and forget about them until breeding, because a lot of mastitis occurs in the post-weaning phase.
Perfect. And then can you speak on udder edema or physiological edema versus bacterial infectious mastitis?
Not with any sort of academic perspective, no. I guess I've seen ewes that have had such bad mastitis that it's complete edema and they're just kind of having white or clear fluid come out of their udders, but I any more than that, no, I don't unfortunately have any answers to that.
Great. Well, that was our last question in there. We can leave it open for another minute or so. Brad, do you have anybody else that's raising a hand in here?
I don't hear at the moment.
Okay. I think the biggest thing, Dr. Murphy, is as shepherds, a large proponent of this is environmental and what we're doing as caretakers of these animals that impact that udder health.
Absolutely. Yeah. You know, NSIP can only take us so far. We've got to be good shepherds and shepherdesses, and most of our headway into reducing mastitis is going to be through husbandry. And if you're waiting on a genetic test that's gonna, clear mastitis from your flock, I'd say you're probably going to be waiting until the sun burns out. We need to make sure that we're constantly revisiting our hygiene of our lambing operation and post-weaning management of our ewes, because that's where we're going to really make the most impact.
And the same could be said for a new vaccine that would cover everything. I mean, it's just wishful thinking.
Correct. Yeah.
Perfect. Well, on that note, I'm going to run out and bed the barn, but we definitely appreciate everyone in here. Hopefully you guys enjoyed it again. This was recorded, will be sent out to you. Just want to thank Dr. Murphy again for being willing to come in and be the U.S. udder specialist for this discussion. And we look forward to having a couple more of these this spring, and hopefully we see you again.
Thanks, guys. And you can find my contact information on the USDA website, and I'd be happy to answer any more questions you might have.
Awesome. Well, we thank you again, and everybody have a fun and safe evening.